My name is Ray Lauga, L-A-U-G-A.
Hi, Ray. And I understand that you have a story germane to healthcare reform. Could you tell me a little bit about your story?
Yes, it's about my daughter. When she was 28 years old, she graduated from the University of New Orleans with 3 degrees. Within 5 months, she was diagnosed with multiple sclerosis. 6 months after that, she had an exacerbation that put her in the hospital, and she came out an invalid. Because she had worked the 10 years that she was in college, she was eligible for Social Security. So I applied for Social Security, and in April of 2005, she was awarded full disability benefits from Social Security. Well, in August of 2005, Hurricane Katrina hit, and we lost everything. We lived in Chalmette, Louisiana, and we lost everything. And because of the condition of my daughter, we had to evacuate every time there was a storm close. So we wound up in Arkansas, and then from Arkansas we went to Houston, Texas, because my daughter was on chemotherapy treatments, a strong chemotherapy called Levantron, and she had to have a treatment every 3 months. So we went to the University of Baylor MS Research Center in Houston, Texas, to get her the Levantron treatment. Well, what happened was, because there is no transparency of medical records, and the Tulane University Medical Center, where she was treated in New Orleans, had gone underwater. She had to redo all the tests that they had just run on her in April of 2005. Well, she was in the hospital for 5 days, and that 5-day stay cost us $32,000, because when the storm hit, I lost my job. Eventually, I got my job back, and we moved back to the city of New Orleans. But because Melissa was approved in April of 2005, Medicare did not kick in until April of 2007, because there is a 24-month waiting period there. And because in order to get insurance on Melissa again, she had a pre-existing condition, so nobody would give us insurance on the MS. So all the way through until April of 2007, we had to incur the cost of her treatments and her medicines and stuff like that. Melissa is alive today, even though the doctors in April of 2005 gave her 15 months to live. It seems like the Levantron did more than what they expected it to do, and it has stopped the exacerbations. However, she is still an invalid, and she still stays with us at our home, and my wife takes care of her. Melissa is well educated, but cannot use the things that she was educated to do because of her condition. She is starting to have more seizures now. However, we have the Medicare insurance, and we're able to take care of her. However, there are people who have multiple sclerosis, and because of their pre-existing condition, when they leave their work, they can't get insurance. They have to wait the 24-month waiting period. When disasters happen, such as Hurricane Katrina, they go to a different place. They have to rerun all the same tests over and over and over in order to find out and get a correct diagnosis of what the condition is at the time that the new doctors are seeing them. And these things need to be addressed in a health care bill. We need to do away with pre-existing conditions, because somebody could have insurance, lose their job, and then have to get insurance somewhere else. We have to do away with the 24-month waiting period on Medicare. People qualify for Social Security disability and are unable to get this for 2 years. In my line of work, I do Social Security disability hearings and appeals for multiple sclerosis patients. In the last 2 years, I've lost 3 clients waiting that 2-year period to get medications because they can't afford it. And waiting for Medicare to kick in order to get their treatments, they died. Healthcare reform, this is the reason we need healthcare reform in the United States. And I hope you listen to our pleas. Thank you.